Able to stand up straight due to lower back pain, this is the video for you. A lot of people will have this instance if they have a muscle spasm where they maybe pick something up heavy from the ground or light. It could just be bending over and doing routine stuff. If you have some sort of stenosis, and you've noticed that there's progressively leaning forward. So those are the two things that usually cause people to make it really difficult to stand up straight. So what can be done about that? A lot of people think that there's nothing that you can do, that you just need injections and surgery and all that type of stuff, but there are answers for it. So number one is finding a couple different exercises that work for you and a couple different modes of exercise. So that can be walking, that can be doing gentle stretches, that can be swimming, that can be cycling, and then also working on finding positions that feel good. So sometimes bending forward in a standing position feels awful, but if you do it in a chair, it feels a little bit better. And if you do it while on all fours on a table, like in a child's pose, I have lots of videos about that. That can feel better. Additionally, if you're having trouble actually standing back up, like we're talking about in this video, sometimes practicing the forward bending stuff is a little bit better. And then on the table, if you're doing extension-based exercises, we want to practice getting into a little bit more extension. So if you're like this, right? If you can't sit back up like this because it hurts too much, we need to practice getting into that position. So we don't want to push through severe pain, but we want to make sure that we're actually not completely avoiding the position, because what happens is you progressively just get more and more and more and more and more bent forward if you never address the issue. So really, first step with this is to find a mode of exercise that works for you, that gets your heart rate going, that gets your breathing up higher, gets a little sweat. And if you can't do that, or you always want to find a couple different movements that work for you. So it can be movements in a seated position, working on bending backwards and bending forwards. It can be in a standing position, bending backwards and forwards. And it can also be in a lying flat position on your belly, bending backwards and bending forwards. There's lots of different options available for that. And in other videos, I have gone through directional preference, so finding a movement direction that feels better. And once you find that, you can practice it and slowly progress it from there. So if you're only bending backwards 5 degrees, you want to work towards bending backwards 10 degrees and 15 and 20, and slowly increasing that over time. The error that a lot of people make with this is they try to just do way too much. So they think that more is better. More is not better, more is just more. You need to find the appropriate exercise dosage that fits your body's tolerance. So you have to find the amount of exercise that works for you, that makes you feel a little bit better and doesn't make things get all flared up. So that's the main thing. If this was helpful for you, please like this video. Go ahead and subscribe to my channel by clicking the button below. You can also check out my free Facebook group. It is around 2,000 people at this time since making this video. All of that is in the description below. And until next time, have a strong and resilient day.